Welcome to another conversation of the Writer's Edge podcast. I'm Farley, your host, and today I have the pleasure of having a conversation with Amethyst Barto, physical therapist from Ohio. Welcome. Thank you so much for coming on the podcast with me.
Thank you for the opportunity. I appreciate it.
And we start out the podcast the same every time when we have new guests on. I'm a full believer that you are the best teller of your story. So give us your story of your journey with your horses and physical therapy.
In regards to the horses, I've been riding since I was about 5 years old. I grew up riding and competing in the hunter jumper world for about 15 years. And then at that point, I went to the dark side of going cross country schooling and I started doing eventing at that point. And since kind of more recently, I've kind of gone the more dressage route at that point, looking more into like the fundamentals of everything and more technique versus just galloping at fences. um, so I have a off the track thoroughbred mare. She's 13 years old at this point. And like I said, right now we're doing eventing, dressage, just kind of trail riding and leisure at that point. Um, in regards to physical therapy, I have been practicing since 2014. I went to the University of Findlay in Northwest Ohio. Also rode on the equestrian team there. And since I graduated, I've worked in outpatient orthopedic clinics. I was fortunate enough to work in one for a long period of time that I managed. And then I went on to another clinic at that point. I was only there for a few short months. And through those experiences, I kind of saw some shortcomings in outpatient orthopedics, where the patients weren't necessarily getting what they needed. So at that point, I kind of started exploring options of going out on my own. So now, just since this past February of 2023, I have started my own practice. It is a mobile physical therapy practice, and I see a lot of kind of chronic pain, spine issues, but I do also tailor mostly towards equestrians at this point, because we all have chronic issues. We've all have injuries with that, and it kind of ties in with my treatment style and my background quite a bit.
I I love how everything always ties in. That's why it's always interesting to me to let somebody tell their story because then you can see how the paths all weave together. So tell me where you're
Oh,
located.
absolutely.
Yeah, tell me where you're located. So if anybody is going,
I'm in,
oh, I need to talk to her, let's get people hooked up with you.
I am in Northeast Ohio, kind of serving that area. So I'm mobile all through that area, and I've kind of slowly been expanding my borders a little bit into more southern, central Ohio area too.
Excellent. There's a big horse population up through there. And so yeah, that's great. And it's interesting that you bring up dressage and how you've transitioned over to that some. I was able to ride this summer with a dressage trainer and helped me immensely with my horse Chuck and my barrel racing and connecting his front half to his back half. I was missing the middle and got to none of the information was new to me, but it clicked. Like there was missing information that finally clicked for me. And so and I'm sure that's probably the same. You're finding the same thing with eventing and then going back towards some dressage things, and you're going, "Oh, it's not something brand new, but it clicks in a different way, and it's able to expand your horsemanship on."
Oh, absolutely. I agree with that 1,000%. 1,000%. All the fundamentals that you knew, but like you said, it just puts everything together a little bit better.
Mm-hmm. Mm-hmm. So tell me, you've been in your mobile practice, so tell me kind of some common themes that you have seen with your riders and how that has progressed.
So with my riders specifically, I see a lot of spine issues. whether it be people having low back pain, people having neck pain, and kind of tying in with that, I do see a lot of riders who actually have like migraine issues as well. Um, and what I'm finding more and more is it all kind of ties back to some similar issues. Number one being the nervous system. And that's something that not only for necessarily spine pain, I always assess and treat is for any side type of injury. So I am always looking at the nervous system. I think posture is an outward expression of the nervous system. So if we have dysfunction in through our nervous system, we're going to have dysfunction in through our posture as well. So specifically with riders, that's extremely important. Not only just our upright posture, but our symmetry as well. Because if we're not functional through our posture, our horse is going to struggle with that as well. So with a lot of my riders, I'm constantly assessing the nervous system, tying that into how is that affecting their posture? How is that affecting their ability to keep their center of gravity over their base of support? And then how is that affecting their symptoms? Is there lower spine pain because of a nerve irritation up top in the neck? Is there neck and headache pain because of a nerve irritation in the lower back? Or is it all kind of tying in together, which is more often what I see?
Yeah, I think I know the nervous system is where we're missing a bunch of things, right? And I think if you've been in orthopedic sports medicine, or even how riders think of orthopedic sports medicine as it's just muscle and joint, right? It's the nervous
Absolutely.
system that's running the show. So we've got to look at
Mhm.
that. And I think whether you're a practitioner or a rider or whatever, even with your horses, we've got to be tuning more into the nervous systems, how they're affected, what we can do to change that, whether we're looking at posture, like what you're really honing in on, or myofascial work, or any part of that. So take me through a little bit of some of the work that you do with the nervous system with some of your riders.
So I always start with a full body screen. I'm looking at my rider from head to toe, no matter what they're coming for. If they're coming for a pain or dysfunction, um, some sort of symptom, or if they're truly coming for just a riding performance assessment, I will always kind of look at their posture from head to toe. Does their head and neck sit at midline when they're, regardless of their eyes are open or closed? Are their shoulders symmetrical? Is one higher or lower than the other? Does their shoulder blade sit further out from their spine at rest or closer to their spine, and going all the way into how is the pelvis tipped and rotated? Is one side of the pelvis higher than the other? Getting down to the nitty gritty, even looking at fingers and toes. I do utilize an assessment technique from what's called the myokinesthetic system, and that is a quick posture screen. And what it does is it helps you to determine which nerve root, which level of nerve is the most irritated in their body. Because again, as horseback riders, and this also ties in with my patients who have chronic pain, it's usually more than one nerve that's irritated in our body. We have a lot that gets on our nerves. Um, so determining, is this, again, say somebody has an irritation at their in their neck at like their C5 level, in their low back at their L5 level. Well, what's driving the bus here? Is their lower body affecting their upper body or vice versa? So the myokinesthetic system is really helpful in helping to determine where to begin. So after I do the full body screen, we then kind of know where we need to hone in our treatment, whether it's cervical or in the lumbar area or somewhere in between, or even the sacral area, which is what I see a lot with riders, especially. And then from there, what we tend to do is treat that nerve via the myokinesthetic system, but then that also gives us a starting point. Okay, well, just because you may have headache pain or neck pain, this is really being driven by your L5 or your S1 or something going on down there. Let's dive a little deeper to see where the true dysfunction lies, where the root of that cause lies.
Ooh. I love that because you're given connection to it. And I'm particularly if you're working from the sacral area, especially for riders who have been riding their whole life or a good chunk of it, there is certainly all sorts of micro trauma that happens
Right.
through that area just from the nature of the sport.
Absolutely.
So,
Absolutely.
yes, go ahead. You can expand on that for sure.
I mean, that's a huge thing that I see with riders. Our sacrum, it's the bottom part of our spine. And it tends to take, obviously, with riders, it takes a lot of impact, whether it's, you know, from traumatic falls that we may have had, or even just bopping around in the saddle. You know, we weren't necessarily designed to be doing that. So our sacrum takes a lot of that. And that being kind of the bottom part of our spinal cord, the bottom part of our nervous system there, if that gets irritated or if there's dysfunction going on down there, whether it be because of a hyper or hypomobile sacrum where your sacrum moves too much or not enough, or same thing at your pelvis, anything could be causing, you know, irritation down there. That's where I see kind of compensation stacking on one another and progressing kind of up through the spine, potentially causing whether it's low back pain, thoracic pain, kind of in through the rib cage and the shoulder blades. And then a lot of those neck and headache symptoms that I see riders have a lot of too. It all tends to, a lot of the time, go down to the sacrum.
It's amazing how connected everything is. And I still, even practicing as long as I have, it's amazing how something at the sacrum can be causing head and neck pain or vice versa. And we get so honed in. And I think this is where a big misconception again with it's just muscles and joints happens of, well, I'm not hurting down there. Why is that causing my issue
Right.
up here? And we get because as humans we want to keep things simple, right? If we can't understand it, we want to keep simplifying it down until we finally get it. And
Oh, absolutely.
so being able to take it from that complex, people want to go, no, it's just right here, it's just local, this is where the issue is. And the root cause is often not at all.
Absolutely. And, you know, I do a lot of education with that. When I am doing my assessment, I am talking my client through it. I'm, you know, why am I looking at you from head to toe? Hey, we found that your head and neck pain is coming from your sacrum. And as I'm explaining to them exactly what I'm finding, typically what ends up happening is they start saying, oh, you know what? Now that you mentioned that, you know, it wasn't my neck and my head that was hurting me at first. I did have issues with low back pain, but that went away. And then my neck pain came about. So they kind of start to realize how their body was compensating for things, or it's reminding them of, oh, you know what? I did have this really bad fall, or I did have this bucking incident. And that's kind of when it all started at that point. So the more kind of that I educate them and talk them through what I'm doing, it kind of brings about all of that. And then they kind of start to understand a little bit more of, you know, hey, we need to treat the root cause and treat this instead of just treating the symptom.
Hmm. It continues to blow my mind away, whether I'm treating horses or riders, how the intelligent design of the body, how it will get through not any, but a lot of different scenarios to keep us safe, to keep us moving, to keep us healthy. And that micro trauma, I call it micro trauma often in a lot of cases, builds up over time, but our body will compensate to keep us going. And we're so driven with our horses, we don't even, if it stops hurting, we often don't worry
Oh,
about
right.
it
Right.
anymore. We're not good patients that way.
No, exactly. Horse people are hard to treat, which is why you have to be a horse person to treat them.
Mhm.
You have to
100%.
understand our mindset.
100%. So take me through some of these compensations when you have done a postural assessment with your riders, and the compensations that you see on the ground and how that translates into their riding and different aspects of your practice that way.
So I do see a lot of, so kind of going back to the pelvis and the sacrum conversation we were just having, I see a lot of people in general, whether it's a rider or not, I see a lot of people who are very asymmetrical and more stiff on the left side of their hip and their pelvis and their sacrum, causing kind of a torsion through the up through the spine as well. And again, in our day-to-day, we're typically pretty good at compensating for that. But the moment we get on the horse, that's going to become more and more apparent. So when I'm kind of talking through these things with some of my clients as well, that's another thing where, you know, if I'm noticing that they're very kind of locked down on their left side and through that left hip, that left leg, as I'm talking to them, again, they'll kind of say, you know what? I do notice, you know, I feel like my right side has to kind of come up as I'm riding. And because of that, I have a difficult time picking up my right lead or my left lead or bending right or bending left. Um, so as soon as, you know, we can compensate for ourselves, but as soon as we get on the back of a horse, they're going to compensate for us or things just aren't going to work out in our favor, you know? So that's a lot of where I focus on not only symmetry of posture, but you know, symmetry of movement as well. Once we start to calm the nervous system down and get someone's posture to be more normalized and more symmetrical, then we can work on the other aspects, any sort of joint tension from that chronic nervous system holding, or any sort of, you know, neuromuscular re-education we may have to do with the muscles at that point, and then finally progress to the strengthening portion of it. But in order to get my clients successful in the saddle, I always kind of look at their nervous system and their posture first, get our compensations out of the way, then we can kind of get them in the saddle and see, okay, now that you're a little more freed up and you have a little bit more symmetry, are you still having those same problems with your horse? And a lot of times the answer is no.
Yeah, and it can just click like that, because a lot of times once you get that freed up, the body knows exactly what it needs to do to get the task done. Why do you think, what's your theory of it's all, you see a lot of the left side lockdown versus right?
So I think a lot of that is regardless of our own hand dominance, we live in a right-handed world. The world is designed for right-handed people. So we're constantly kind of reaching with our right arm, twisting across our body a little bit. So whether we're shaking somebody's hand, we're always doing that motion. Opening up a door, doors are typically designed to be opened that way. A lot of what we functionally do on our day to day is built to be done with that right side where we're kind of compensating and rotating to the left a little bit.
Oh, that is a I I was very curious because you specifically brought out left, and I think about it and I was like, oh, I that makes a lot of sense of why that gets, because it gets locked down to stabilize, to rotate across.
Right, right.
So if our listeners want to get in touch with you, if they've listened to this conversation, and they want to work with you or reach out for any reason, how would they get in touch with you?
My website. So my business is Acclivity Integrated Physical Therapy. So my website is Acclivity, ACCLIVITY, PT.com. And all of my information is on there. I'm also on Instagram as Acclivity Integrated PT and Facebook as Acclivity PT as well.
Awesome. And give the listeners two things in general that they could do today that would help them in their general day-to-day and their general riding goals.
Two tips in their day to day. I would say the first thing is, we just kind of talked about how the world is designed for us to be a little bit asymmetrical. So the first tip I would say is definitely just being aware of what you're doing with your body. When you're sitting driving in your car, I know personally, being a mobile PT, I'm in my car a lot. And I notice I kind of lean towards my right side armrest a little bit just as I'm driving around. So, kind of being aware of any sort of asymmetries you may have in your day to day. Do you sit crooked when you drive? When sit at your work desk? Is there anything that's on one side of your desk? Just kind of being aware of that and noticing, okay, try to keep everything in front of me a little bit. And if I have to turn one way throughout the day, make sure, I'm doing something to go to the other side as well. So being aware of your symmetry out of the saddle. And then also too, once you get aware with that, trying to be aware of your symmetry once you get in the saddle too. Regardless of what discipline and what kind of saddle you're sitting in, taking your feet out of the stirrups a little bit and just relaxing and think, okay, without even trying, am I weighting one seat bone more than the other? Do I feel like I have to hold one shoulder up or down? Or, is my instructor, my trainer, my friends always yelling at me to, keep this shoulder down or, stretch one leg down? Pay attention to that because once you're aware of it, you'll start catching it a little bit more and you'll be more conscious of that symmetry.
Those are great tips because they come back to also just foundational movements and foundational things and working on the basics, working on the foundational stuff is often not sexy. That's why we
Right,
have to be
exactly.
that's why we have to be told that's these things often and get it repeated and get reminded even if we know these things because we need help in the just champions. Champions are masters of the basics, in my opinion. And so, and those aren't sexy. Like they are mundane, common, everyday things that get repeated over and over and over.
Absolutely. And that could be our best friend or our worst enemy too, depending on how we're doing it.
Absolutely. Absolutely. Well, Amethyst, thank you so much for coming on the conversation today on Writer's Edge podcast. I really enjoyed your insight and hope to do it again.
I appreciate it. Thank you so much.
Thank you guys for coming along on this conversation of the Writer's Edge podcast. And as always, I will see you down the road.